A healthy child suddenly starts to behave differently. They become aggressive, they forget things, and not like themselves. So, today we are again with Dr. Abhishek here talking about autoimmune encephalitis, which is a situation or a condition where our own brain mistakenly attacks us. So, doctor, today let us hear from you what autoencephalitis is and why is it called an autoimmune disease.
Autoimmune encephalitis is a disorder of the brain where our own body affects the brain tissue. So normally whenever there is an infection in our body produces certain antibodies which try to attack the organism, could be a virus or a bacteria, by producing a lot of chemicals. But sometimes what happens, our own body is unable to understand that, and the immune system works against our own brain, resulting in this condition known as autoimmune encephalitis.
So, we've heard that this condition is often considered as a psychiatric illness. Why do you think that keeps happening, especially when it's not a psychiatric illness?
One of the most fascinating aspects of autoimmune encephalitis is often children can have psychiatric issues before the actual neurological symptoms start. A child who is normal suddenly starts behaving aggressively, uh, start having memory issues, starts having sleep disturbances, often becomes very anxious, developing speech issues. So that is why often the parents refer these children to a psychiatrist. In this condition, the psychiatric issues start initially, followed by the neurological symptoms in the form of cluster seizures, movement disorders, speech issues, and then having movement disorders like unable to walk and so forth. So that is why one important point to remember here is any child who has a lot of behavior issues followed by neurological issues, that is the thing which we need to look out for autoimmune encephalitis.
And when we call it an autoimmune disease, is that does that mean something like the body develops some kind of immunity against it, or what does that mean?
In a way, yes. In autoimmune conditions, our own body fights against our own cells and thus producing those symptoms. So, in autoimmune encephalitis, our own body produces certain antibodies which affect the brain and causing these kind of symptoms in the form of psychiatric behaviors followed by neurological symptoms.
Which children are most likely to develop this condition? And do you think it's a very genetic condition, or is it something that comes out of the blue?
Unlike many inherited neurological conditions, autoimmune encephalitis is not a genetic condition. It can affect any children of a school going age, but commonly seen in school going age children and adolescents. So sometimes it could just be triggered by a viral infection. The host immune system is unable to identify that properly and starts mounting an abnormal response, resulting in autoimmune encephalitis. Most of the time, the pathophysiology is not properly understood, but it's a combination of a trigger, certain viral infections, and the host immune system resulting in this condition.
What are some of the warning signs that parents should look out for in children that might actually have this condition?
Yes, any child who is a previously normal child starts having a lot of cluster seizures, followed by behavior issues, speech issues, a lot of movement abnormalities. A child who was walking previously starts having difficulty in walking or even sitting. These are the signs you should identify. It's not one sign, but a cluster. All these signs together help us to identify that yes, this could be autoimmune encephalitis.
In such cases, how do we identify in the diagnosis or confirm the diagnosis that this particular individual is going through this? Do we have like a singular test that can identify us?
See, diagnosing autoimmune encephalitis always begins with the clinical history. What was the history before the child presented? Was it cluster seizures? Was it movement abnormalities? Was it a lot of psychiatric or behavior issues? Altogether, we after this we get an MRI to see is there an abnormalities in the brain structure. We do a lumbar puncture, or we basically draw fluid from the spinal column and then analyze that for infection, and then we do certain autoimmune antibody testing that helps us to know whether this particular set of antibodies are present or not. So it's not just one test, it's always a combination of the history, the examination of the child, and certain investigations like the MRI, EEG, lumbar puncture, along with certain blood tests, help us to know that yes, whether this could be an autoimmune condition or not.
How important in such situations is early diagnosis?
It's very important to diagnose the child early. Unlike other neurological or neurodegenerative conditions, autoimmune encephalitis, if you're able to identify early and appropriately treat, you can prevent a long-term irreversible injury. So if you are able to diagnose early and you start the treatment, most of the kids are able to recover quickly. But if there is a delay, then there is potential, risk of having sequelae, or it might delay the recovery of the child.
Since this is a condition where our own immune system is acting up on our brain system, how is the treatment actually done in such situations? Do we have treatment that can actually address this concern?
Yes, there are treatments. Now, depending on the child's condition, sometimes some children can present in emergencies in the form of, altered sensorium or a coma-like situation, where they might, be required to be admitted in the ICU. Sometimes they have breathing issues, so they might even require to be put on a ventilator. Medicines which are tried are high dose IV methylprednisolone is tried. Sometimes you give IV immunoglobulin. Depending on the child's condition, some might require plasma exchange or some other immunomodulation medicines are required. This is the acute treatment. Once the acute treatment is done, the child is out of the ICU, then the rehabilitation process starts in the form of physiotherapy, occupational therapy. Sometimes there might be feeding issues, so it might require certain feeding tubes. So depending on the child condition, the child might require ICU management or sometimes just management of the ward. Along with these medicines, certain children also require anti-seizure medicines because they can present with seizures or status epilepticus, which could be a seizure lasting more than half an hour. So depending on child condition, appropriate medicines are used.
The treatment that you've just mentioned sounds quite intensive, in at least in some cases, I'm assuming. How is the recovery of these children that go through the treatment and this condition? How does that look like?
Most of the times children recover completely. So it always depends on how early you identify the condition. If you're able to identify the condition early and intervene timely, most of the kids can improve very well. Sometimes some kids may require weeks to months to improve and also might require rehabilitation procedures like occupational therapy, physiotherapy, NG feeding, anti seizure medicines to continue. So the most important thing is identifying the condition early, and timely management helps to recover better.
So the recovery rate of this condition is a 100%.
Most of the kids do improve, but certain times if that identifying the condition and timely management is delayed, then some kids might have a delayed recovery, sometimes even up to years.
Since this is like an autoimmune disease, does this have a chance of relapsing and coming back again once we've assumed that it is recovered?
Yes, certain forms of autoimmune encephalitis have the chance of having relapses very frequently. So, what's more important is we continue the immunomodulation medicines to be continued. Frequent follow ups are required based on the child's condition. Sometimes repeated tests are required, and additionally, rehabilitation process like physiotherapy, occupational therapy has continued. So, if you are able to continue the medicines, most of the times you are able to reduce the risk of relapses.
So this the recovery process is rather a ongoing process that
Yes.
we keep doing.
Yes, the recovery could take sometimes weeks to months.
Finally, doctor, what is the one message that you would say every parent that is watching this video with us today? And what is that one core message that you want parents who have kids having these conditions with us?
So, one thing which I want to share with the parents is if your child who's previously healthy has cluster seizures and starts losing acquired milestones, starts losing his speech, has a lot of movement disorders, has a lot of psychiatric issues, is very irritable, difficult to manage, or has difficulty in walking or sitting, don't ignore. Often, this can start with a febrile or a fever infection, and often parents attribute to a weakness which happens after a fever, but it's not in every case. In neurology, time is brain. Earlier you diagnose, identify the condition, and start the proper medication, the recovery can be better and you can avoid the long term issues in your children.
Thank you again. This is Dr. Abhishek on autoimmune encephalitis.